represent you guys well.
Surrounded by medical students and members of his caucus, the Premier announced a plan he says will ensure more Ontario doctors practice here.
Our government will prioritize med school seats for Ontario students. Starting in the fall of 2026, all Ontario medical schools will be required to allocate at least 95% of all undergraduate seats to residents of Ontario, with the other 5% reserved for students from the rest of Canada.
The health minister says it wasn't right to use significant public funds on those who don't live here.
Whether they are physicians, nurses, lab techs, we're making an investment in Ontario residents, and then when there are other opportunities, Canadian residents. We know through our data that when students train, practice, and learn in the province of Ontario, they stay.
But how many international students are actually studying medicine in Ontario? According to the province's own data, just 10 of the around 4,000 current medical students are international students. 88% of students are Ontarians. The government's critics say this move won't make the difference the Premier says it will.
The university who's most impacted by this decision is U of Ottawa, who gets quite a few French-speaking students from Quebec who comes to Ontario to study medicine, who become physicians in Ontario. The government does absolutely nothing to keep those Ontario-educated French-speaking physicians in Ontario.
The government is also investing $88 million over 3 years to help more Ontario students become family doctors by footing their education bills, doing so by expanding the Learn and Stay program to include medical students who commit to practicing family medicine. But critics say the government is still missing the mark.
This move may well incentivize more people to choose family medicine, but it will do nothing to ensure that they stay in family medicine.
The government's move comes after months of the opposition telling the government that it's not doing enough to ensure all Ontarians have a primary care provider. The opposition will have its chance to tell the government if it thinks it's investing enough in tackling the problem when the fall economic statement comes out next week. Clara, Pasieka, CBC News, Oshawa.